How do conditioned responses drive addiction triggers? Imagine walking into a room and suddenly feeling a strong urge to do something you used to do there. That's often how addiction triggers work, and it all comes down to conditioned responses. When it comes to understanding substance use disorder, knowing how these responses develop can really help. Let's break it down in simple terms. Classical conditioning is a type of learning where a neutral thing, like a place or a smell, gets linked to a meaningful event, like using drugs. If someone always used drugs in a certain spot, that place becomes a cue. Just being there can make them crave the drug, even if they aren't thinking about it. It's like the brain remembers the good feelings and wants to recreate them. Operant conditioning is another piece of the puzzle. When someone uses a drug and feels relief or pleasure, their brain learns that using leads to good feelings. So, they're more likely to do it again. Over time, seeing a syringe or hearing a lighter can automatically make them want to use because their brain has linked those cues to the reward. These cues become triggers that push them toward drug seeking without even thinking about it. The brain's reward system plays a big role here. Drugs cause a flood of dopamine, which makes us feel pleasure. When someone keeps using in certain situations, their brain starts to see those situations as linked to that dopamine rush. Even after stopping, just seeing a familiar object or place can cause a small dopamine releases, making cravings stronger. People with substance use disorder tend to pay more attention to drug-related cues. They notice triggers faster and respond more strongly than others. For example, someone who used to inject drugs might react strongly to the sight of needles, even if they're trying to stay sober. This focus on drug cues makes avoiding triggers really tough. Memory also plays a part. The brain stores vivid memories of drug use, and triggers can bring those memories back. That's why being in a place where someone used to drink or use drugs can suddenly bring back intense cravings, even years later. Understanding how conditioned responses work helps explain why relapse happens so often. Triggers are everywhere: stress, certain people, specific times, and they're tied to powerful memories and feelings. That's why treatment often includes learning how to spot and handle these triggers. Techniques like cognitive behavioral therapy teach skills to manage cravings, and exposure therapy helps weaken the connection between triggers and drug use. In short, conditioned responses link neutral cues to the rewarding feelings of drug use. Through learning processes, these cues become powerful triggers that can cause cravings and drug-seeking behaviors. The brain's reward system, attention biases, and memories all work together to make triggers hard to ignore. Recognizing and managing these responses is a key part of recovery, helping people build new habits and responses to old cues.